Good afternoon, everyone. We are at the top of the hour, so we are going to get started. Thank you all for coming to this presentation on sheltering and animal care during disasters. My name is Dr. Caitlin Macy, and I am the District 9 Field Veterinarian with the Board of Animal Health, and I'm also leading the state's Veterinary Medical Reserve Corps, which is involved in training, developing, and deploying animal emergency response teams. So today's speaker is Dr. Sandy Norman. Dr. Norman is a graduate of Purdue University's College of Agriculture and College of Veterinary Medicine. She accumulated 15 years of experience in private practice as a companion animal and equine veterinarian in central Indiana before joining the Indiana State Board of Animal Health. Dr. Norman retired from the agency in 2021 after 26 years serving the state of Indiana as Director for Companion Animal and Equine Programs and coordinating the agency's planning for natural disasters. Even in retirement, she remains active in practice as well as volunteering her talents for the health and well-being of animals. She has a long history of working with the feral cat community in trap, neuter, release programs and instructing in the Canine Search and Rescue Academy at the Indiana Department of Homeland Security. Dr. Norman is a member of the National Veterinary Response Team, which responded to Hurricane Katrina and other disasters, along with attending animals at national special events. She shares her life in Indianapolis with her husband, Fred, and her dogs, and always enjoys spending time with her daughters, their husbands, and grandsons. So thank you for joining today, Dr. Norman. Just a couple of housekeeping items before we begin. We will have a Q&A session at the end of this talk if you are muted. If you think of, you are currently muted. If you think of any questions during the presentation, please feel free to type them in the chat box on the bottom right-hand side of your screen, and we'll try to address as many as we can at the end. And you can either direct them to BOAH or everyone in the chat section, and we'll go ahead and answer those at the end. And just so you all know, 1 hour of continuing education is provided for this webinar. Please, at this point, give us several weeks to get back to you regarding your CE certificate, but we will get that to you. And if you don't hear from us in about a month, please feel free to reach out. So at this point, thank you, Dr. Norman. Please take it away.
Thanks, Caitlin. I appreciate it. Okay, so this is a compilation of, this is just talking about sheltering and animal care disasters, something veterinarians should be considered about in their own community. And so we're talking about local planning because unfortunately when a disaster happens, that's not the time to do planning on what you're going to do with the animals that you're dealing with. So let's go ahead, and this is this picture here actually is from Hurricane Katrina. That's the first disaster I responded to, and this is down at Lamar-Dixon. And this is what it looks like after all the animals come in and they're in cages. Looks much different before that. Let's see. Oops, I'm sorry. Just a minute. Let me get back to my presentation. What did I do? Oh, there I did. No, leave you sharing. I went to share. Share. Okay. How do I move forward? Arrow. Arrow. That's what I did, and it went out. Okay, let's move to the next slide. Oh, there we go. Okay. So why do we rescue and shelter? The reason that animal rescue and sheltering, and it started back in 1992 with Hurricane Andrew, is public safety. Animals get out during a disaster. And during Hurricane Andrew, there were monkeys in the street of Miami because there was a lab facility there and the monkeys had gotten out. We do want to protect people and animals. We know that animals are an important part of people's lives. And so we want to surely protect the animals because they're part of the family. Public health, we know that disease spread and disease outbreaks do occur in light of a disaster because of the mixing of people and animals. So public health is important. Protect mental health, and we know about the human-animal bond and how very important it is to people. I can show you pictures of people who were overwhelmed because they'd lost everything, but they found their cat or they found their dog. And in the midst of all disaster can find a great source of support. So mental health is very important not only for the people and their animals, but for the responders too. And then property preservation. In the case of livestock and things like that, this is their livelihood. And so preserving property, especially in the case of livestock, is very important to the general public. So our objectives are to understand the need for sheltering and services for animals in disaster, identify the elements of establishing a shelter, and describe processes necessary to operate a shelter, and understand how and when to conclude a shelter. What you have to understand, and we have done this, for example, in the flooding that occurred around Columbus, there was a shelter established, and one of the issues is, when do you close it down? Okay, because there has to be an end to it. Okay, so as a result of Hurricane Katrina, the Pet Evacuation and Transportation Act, or the PETS Act, was signed by President George Bush in October of 2006. During Katrina, there were literally thousands and thousands of animals, and there was no specific plan in place. So what it was is an amendment to the Stafford Act, and the Stafford Act is what allows states and counties and the nation to create a mechanism to respond to disasters. It was originally created for nuclear and now has evolved into emergency management. So it requires state and local plans for household pets and service animals. And it allows FEMA to cost share money, so for training, for buying equipment, for establishing shelters, and then it allows the FEMA director to make contributions for preparedness. So you can actually, your local county can actually get money at the state and federal level and to help create plans for animal sheltering or animal response in disaster. And the Community Planning Guide, CPG 302, actually includes planning guidelines for rescuing and sheltering animals. So it was important to include it at the federal level because that allows the funds for emergency preparedness to be used for animal issues and disaster. So let's talk about your populations in need, and that's going to very much vary by the county that you live in. Okay, so just so you know that the PETS Act has a definition of a companion animal: a dog, cat, a bird, a rabbit, a rodent, or a turtle. Those were established at the federal level. They may be owned or unowned. The problem is that doesn't include reptiles, horses, livestock, or non-commercial breeders. And the problem with you at the local level is it doesn't really matter if that's the definition of a companion animal. You're going to be expected to respond for all the animal populations that you have. So one of the important things is to establish what kind of animal populations do you have in your county or your area. There are service animals, and that's established by the American with Disabilities Act. That's not emotional support animals. These are things like seeing eye dogs, hearing dogs, PTS dogs that are part for the disabled. They provide a specific service for a disabled person. These are not pets. They are treated as an extension of the person. So actually Red Cross has to shelter these animals because they're not another dog just by your side. They're actually an extension, and they provide a service to the disabled animal. Does not include mental health or emotional support animals. That is not included in the ADA. They must be sheltered with their owner. A blind person cannot be separated from their guide dog. A hearing person cannot. So if it's an ADA animal, it has to be sheltered with its owner. Service animal considerations, those have to be done at citizen or special needs shelters, and the Red Cross is going to ask you, because the Red Cross has been told they have to accommodate this animal, but they're not going to have the things they need. So you're going to have to provide potentially food, water, bowls, bedding, some sanitation supplies, potentially a kennel, although these dogs generally don't always stay in kennels, but be ready because the Red Cross knows they have to accommodate these people, but they do not have the supplies to take care of them. So that's going to come from the local level. They're going to ask the local level, can they have some of these things to take care of these pets? Okay, types of animal shelters. We have a long list of animal shelters. This is actually the horse ward at Hurricane Katrina. We had 6 different wards, and 3 and 4 in the middle accommodated the horses. They're actually taken by the LSU veterinary equine group for 2 months. That group, those students got quite an interesting accommodation of horses to take care of. So there are 10 different types, and that's just to let you know that not every type of shelter works in every county or for every situation. So we're going to talk about the most common ones. And actually, over the years, from 1992, when we first responded to animal issues, to now, we've expanded and the number and types of sheltering that we do with animals. So just so you understand, there's lots of different kinds, and we'll go through these because some may work for you and some may not. So standalone sheltering is what happened in Katrina. It's where the animals were rescued from certain situations and they were taken to a separate facility from people. We are completely separate. It is very temporary. It has to be temporary, so there has to be an end to it. It operates under shelter management, and we do everything under the incident command system. If you have not taken ICS 100 and 200 and you want to deal with disaster medicine, you have to take ICS 100 and 200 and understand the incident command system. It includes owned and unowned animals because owners have lost their homes. They have no place to put their animals. Local authorities determine the length of time. For example, in Columbus, Indiana, they determined that after 2 weeks, we're no longer going to shelter these animals. You've got to find a place to put them. And it needs the most staffing because staffing has to be there 24 hours. So it requires almost 3 times the staffing of a shelter that maybe the owner helps out with. So, for example, at Lamar-Dixon, we had about 1,500 animals and we had lots and lots of staff. Probably hundreds of people did various amounts of staffing down there. So it's a shelter that it's a shelter that requires the most time and effort to keep and maintain. Co-located shelters are where you have a Red Cross shelter in one, for example, in a building, or you have a tent outside where the animals are, or the people are in the school cafeteria and the dogs and cats are in the gym. It's where the animals and people are located in close proximity to each other. And that way they can help in the care of their own animals. Requires almost 1/3 the staff, but it requires a lot of security because you have to make sure the animal is attached to the owner who is going to take care of it. So that way they can sheltering, by the way, is not terribly common in our state. We never have very large sheltering because sheltering is really very boring. People don't like to be in shelters. They would rather they tend to want to house with friends and relatives. So if you have a co-located shelter, the people can come out and take care of the animals. We had that in the case of the Kokomo tornado where in the community center, they had 100-some people and we had their animals housed outside underneath a tent. Cohabitated shelters are very new. This happened during a hurricane in Louisiana and it happened by chance. People showed up with their animals. I don't know if you know that there's a lot of movies that are filmed in Louisiana and there's a large movie studio which couldn't function, and so it allowed animals and people to live next door to each other, and essentially they took care of their own animals and they lived in their own little space there. Again, that's a temporary one. It needs very few workers. You just have to get food to the people and food for the animals. These are animals, of course, they have to be able to get along with other people and other animals, so it's not ideal because some animals don't get along when there are other animals in the same space. But for that period of time after the hurricane, in 2 different buildings, they were able to house about 125 people with their animals and they coexisted. It was great because there was just a supervisor to oversee to make sure that the people got food and the animals got food. And actually the person in charge of emergency response said it was very quiet because the animals were not upset because they were with their owner. So when you go into a shelter, you know how much barking there is, when there's animals separated from people. In this case, she said it was one of the quietest shelters she'd ever managed. It needs the fewest workers because you just need a couple folks there. Now, I want to emphasize, you always need veterinarians out here because you're always going to have sick animals. You're going to have sick animals, you're going to have pregnant animals, you're going to have all the animals and all the issues that may come with respiratory infection. We'll talk about that a little bit later. Just remember, veterinarians are a very important part of the shelter situation. So here's other sheltering options. In many cases, for example, in Columbus, they used their own shelter. They were able to relocate their current animals to surrounding shelters that weren't affected and then emptied out all their cages. So they just used the shelter that they had, but they got rid of all of their adoptable animals, except for their animals that were quarantined for biting. And they were able to use their existing shelter. Of course, there had to be a deadline for that. Like I said, after 2 weeks, they said, you're going to have to do something with your animal because we have no place to put anymore because we have to continue to function as a shelter. So that's using your existing shelter, but relocating it. And PetSmart helped with that. They pulled the animals out of their shelter and took them to neighboring shelters that had some space to accommodate them. You can use foster homes. For example, if you get to the end of your 2 weeks and you have some animals left, you have fosters who can house them temporarily until the owners can get settled into a different situation or until you have space in order to find homes for them. So you can use foster homes. Registered animal facilities, zoos, anything registered with the USDA, like the breeding establishments, all have to have a disaster plan. It's part of their licensure. So zoos, sanctuaries, biomedical facilities all have to have disaster plans. I participated in an exercise at the animal laboratory downtown at IU at the medical school. They have animals down there, and they have a plan to evacuate all the animals out of their facilities and take them to other animal facilities that IU has away from the city, because IUPUI actually sits on a river. So there's a chance that, especially since the animals tend to be in the lower portions, that the flooding could be a possibility. So all of those registered facilities have a plan. And in certain states, for example, Louisiana requires all of its kennels, any of its animal facilities to have a disaster plan on what they're going to do with their animals. In the midst of Katrina, we had 4 animal hospitals who had given us all the animals in their facility because they had no place to put them. And there's a mixed effort. Sometimes you have to have different models. Sometimes you have to have your shelter, you have to have foster homes, you may have to have the co-located shelter too, so it's actually a mixture of them. The last one I want to talk to you about is called shelter in place. In Joplin, Missouri, they did this. People who had lost their homes wanted to stay with their homes, or they could stay in part of their homes, but they still had their animal and no place to put it. So they dropped off what they call shelter kits, and what that was a cage, a very large cage that had food, or if it was a cat, it was a cat-sized cage with a litter box and shelter and a dish and everything they need, a rope, a leash, everything to keep track of the animal. In other words, they were sheltering in place at their home. They just needed something to keep the animal. They used it in the flooding down in southern Texas. They used it, and it's just where there was an animal and they were able to drop off enough to take care of the animal because the people were staying at their home. So that's called sheltering in place. They also did it down in Texas when they had animals who were put in garages by themselves. They had no place to put them, so they would go around and they would drop food off to them every day. They found a neighborhood where there were animals in the garages. They would check on them once a day, and they were essentially sheltering in place because they had no way to get them out or any place to put them. So that's called sheltering in place. That's another model that you can use. Large animal sheltering is different. We know that's difficult to do. You have to have more space. So here are some classic places they think of. The county fairgrounds is always brought in. We have 92 counties. They all have fairgrounds. That's true. But one of the important things about county fairgrounds is having access and permission, okay? Because county fairgrounds we discovered when we had river problems down in Vanderbilt County, is you have to discover who has the key. It can be the county commissioners. It can be the council. It can be the extension agent. It could be a 4-H person. It can be privately owned. So all of this has to be established before. Remember, you want to establish stuff before you have a flood or tornado or a cold weather incident or a hot weather incident, because you want to know who the access and permission, and you want to have something on paper that shows you have permission to use it. It's great. Fairgrounds are great. You're right. They're a great place to put livestock, but you got to be able to get in there. Do you have somebody who has an empty barn or pasture? It can be very temporary. Sometimes they've just gotten rid of all their chickens and they have an empty barn, or they've just gotten rid of all their pigs and they have an empty barn, or they have a pasture that you can use. For example, in automobile accidents, we've had truck accidents where livestock have been down. They were able to find an empty pasture to put the cattle in temporarily until they could be retrieved. So find out who has an empty pasture or barn. And that's only until permanent relocation. Is there a sale barn or an exhibition facility? Lamar-Dixon at Hurricane Katrina was an exhibition facility, which happened to be empty at the time. So are there exhibition facilities, and they're very nice because they have large parking lots and they have stalls that can be used. But think of other creative solutions. Even Indianapolis Animal Care and Control has some stalls, because while we deal primarily with the pet population, we also deal with some livestock. So is there a small farm somewhere? Sometimes there's retired people and they have an empty barn. It's really important to have at least 2 or 3 locations that you can use, because if the disaster affects one part of the county where you might have a large animal facility, you got to have another part of the county with a large animal facility that you can use in case for the livestock. So leadership and operations. We're asking veterinarians to provide some leadership here. And I know there's lots of people involved, but your veterinary knowledge and your skill is very important to making this work. So who decides? And it's really the county, all disasters are local. The very first class I went to, they stood up and say, repeat after me, all disasters are local, all disasters are local, all disasters are local. When you have a tornado or a flood, it starts there and it ends there. So the decision is made by county emergency management. They're the ones who say, we're way beyond what we can do locally, we need help. And that's when you call in the animal sheltering and rescue team. There's an incident, it institutes the incident command system. You talk about, I need ambulances, I can borrow some, I have some agreements, but now I'm overloaded. And in that case, you might go to the state. So they might come down and say, hey, we've got animals, they're loose, or we have owners with animals, we'll need some emergency animal sheltering. That has to come from the county emergency management. So when you're making these plans, please talk to the county emergency management. If you don't know who they are, I'm sure Dr. Macy or one of the veterinarians from BOAH will help you find out who your county emergency manager is. They would be happy to find you to help do some animal planning. So responsibilities are local. They're local events. Locally responsible parties for animals include animal control agencies, okay? There are also private shelters. We need to work together. Law enforcement, because remember, during a disaster, law enforcement has to enforce the law, and if you need help, like I have to have security or something, that's going to have to come from law enforcement. Veterinary professionals are vital because you can help at least take care of the animals, understand their requirements, and how you can help do that. Public health is important. We know that diseases do break out during a disaster because folks are disheveled, things are turned upside down, and there's a good chance of disease spread both in animals and people. Purdue Extension is vital because they have a connection with the livestock that are in your county. And we'll talk about animal populations depending on your county. Animal welfare groups, they can provide the foster homes, and they can provide volunteer labor because you need lots of volunteers. You're going to take care of these animals even just for a week. It takes a lot of volunteers to take care of it. And then livestock associations. Do you have a cattle association in your town? Do you have a horse and pony group? Do you have a swine for your county? It depends on your county, but these livestock associations are interested in their business going on and that livestock continuing after the disaster is over. So how can they help to make this happen? So remember that the priorities are always people. I know animal people hate to hear this, but people come first. And people with animals are important, but the physical safety of animal, the physical safety of people, the rescue of people is the most important. The animals can come with them, but there is zoonotic disease risk. The owners, the general public, the staff, the volunteers, they come first. So people, life safety for people is first. Animals are second. We know that animals are attached, and we know protecting the animals is important. And then the other property. And that means the owner's equipment and the waterways and the shelter sites and their homes so they can get back to their home. There's all things go, but just remember people and then animals and then property and the environment. That's how they prioritize it for response. So let's talk about managing the incident. Okay, this is a big chart, but this is what the incident command system, and this is how it works. There's a commander, there's operations, planning, logistics, and finance. I encourage you to take ICS 300 so you understand that. I just understand that sheltering is in the operations division, way down there in the divisions and groups, okay? So you're not going to be in charge of that. You're going to have to answer somebody above. But we will also show you an animal shelter chart that will show you how you can do this, use the same system in your animal shelter. So planning, projecting your needs, okay? So what do you need? What are you going to need? Projecting your needs for personnel and equipment. And we'll talk about identifying the animal populations in your county. Documentation. Do you need technical specialists? I have to tell you, as veterinarians, we're not necessarily good rescue people, but animal control people who go out and rescue, pick up animals, stray animals all the time, they're very good at that. And those are the ones we sent in Katrina. All these animal control personnel showed up. That's what they do best. And then when you start a project like this, it's when is it going to end? Because it's not going to go on forever. And just remember, there's an incident action plan. Every day you'll say, this is the incident action plan, and you'll learn that that's part of the ICS system. Commuting planning information up the ICS pipeline is very critical. So knowing what you want, knowing who to ask and how to get it. So what scenarios are most common? We have counties that have rivers that run next to livestock operations, or animal shelters, or neighborhoods. So is flooding your big risk? Tornadoes, Indiana is a tornado state, we know that. What about severe weather? Do you have trouble with cold weather, hot weather, ice, drought? So if you talk to your county emergency manager, he's going to tell you what are the most common scenarios. He knows that already. He's done a hazards risk assessment and said, we have a problem with this. In rural areas, do you have livestock entry? Do you have very large swine operations? Do you have very large cattle operations? Do you have big dairy operations? That's a bigger risk for you because you have larger operations. Do you have a zoo? Do you have a sanctuary that's licensed by USDA? You need to know that because you might have some exotics. In the urban area, the other thing about hazards is, do you have a chemical plant? Like I said, talk to your county emergency manager. Do you have a chemical plant in your county? That's a big risk, and that has its own set of risks. Do you have an animal sanctuary near a chemical plant or near a railroad? All of those are risks you need to know about, and then you need to know, because in Marion County, we primarily have pets, but we have some livestock. But in Carroll County, we have a lot of pigs, and we still have pets, right? So there are issues in every county, and in the county that you're in or the area that you're in, you need to understand what your populations are. If you have a zoo, they have to have a disaster plan. If they have a sanctuary, you want them to have a disaster plan. Every individual owner should have a disaster plan for the animals that they have. If you have llamas, what are you going to do? So you need to have the ability to move them around. Facility selection. It's a good idea to determine where your facilities are. And the rule of thumb is you should have 3 different facilities you can use for animal sheltering. And have an MOU or a piece of paper that says, we can use this in a disaster. Like I said, if it floods next to your first choice, what's your second choice? Because then we've got to move it there. Proximity away from risk. You really don't want your disaster animal shelter to sit on the railroad track, or to sit next to the chemical plant, or to sit next to a place where it potentially is in the line of the disaster that could happen. So let's try to keep it away from those floodplains and keep it someplace else. And that's not unusual. Animal shelters were frequently put next in floodplains. There's one down in Morgan County. That shelter is in a floodplain, and water comes right up to the next to it when things floods. Do you have access to utilities? You need water, you need electricity. If you don't have electricity, do you have a generator that can generate it? That's where your county emergency manager can help. Do you have restrooms? Because remember, you've got to staff this shelter, and you got to have people, you have to have restrooms, you have to have heat or air conditioning, and you also have to feed, you have to support the volunteers. They need food, they need rest, they need access to all of these things. And what is your proximity to human shelters? It's very nice when they can be right next to it. Maybe you can't. Maybe you can be down the street, so the owners can either be transported down there to take care of their animals. It's nice to be near a human shelter. And for example, find out where your human shelters are, because those are already designated by the Red Cross, their Salvation Army. Ask your county emergency manager, how can we work with the human shelters to make this happen? So here's the options. You have an existing shelter that's transferring the animals out. You could have a rented or donated facility. For example, when they had flooding down in southern Indiana, their shelter worked for the animals, but they had no place to put all the food. So they had somebody with an empty warehouse who was willing to it was going to be empty for 3 months, and they could store the food donations. So all their food went to the empty warehouse. Do you have a community facility? For example, in Lafayette, when I-65 closed north of Lafayette, they had to house people. They actually did it in a school situation where the people stayed in the cafeteria, and because all gyms have an outside entrance, they were able, the Humane Society provided cages, and they were put the animals in cages, and the owners could take the animals out through the gym door. So a school works for people, a gym works for the animals, as long as they put protection on the floor. The fairgrounds isn't suitable for companion animals. It does have stalls for horses, for cattle, for pigs, but will it work for companion animals? And generally, you have to provide the cages to go with that. This example, we have a trailer here, a state trailer that has all the equipment you need to set up for about 75 animals. It has cages, it has a generator, it has a variety of things, but we also have 4 of these spread out all over the state. The state's divided into districts. District 1 has one. I think District 4 has one. District 10 has one, and 4 and 5 and 6. I think 6 has one too. So all this is equipment you can use to establish a shelter. It'll get you started, won't house 300 animals, but it'll get you started. And there are a number of these spread out throughout the state. Logistics, remember you need all these things. Cages and kennels, these animals generally come on a rope or a leash. So you need cages and kennels, food and water, sanitation, litter, animal handling gear, and that's where your animal controls come in. And you got to keep track of all these, and so you need the paperwork. Here at BOAH, we've created a lot of forms, and you can use those forms. You can have access to those. Just remember, food gets donated a lot, both in the Columbus flooding and in southern Indiana. They've had trouble with too much food being donated. When they got done, they were able to establish a food bank, which is great, but food was over donated. And the problem with food is your public health department doesn't like the rats in its tracks, unfortunately. So let's think about where you're going to put the food, and you're going to keep it away from the vermin that come with it. Trust me, that was a big problem. We were down at Katrina. We had big mountains of food, and the health department came and said, you got to move it. And we had to put it in refrigerator trucks to keep the rats from it. Livestock holding facilities, do you have stalls, or can you put temporary stalls up? For example, we have an agreement with the state fairgrounds here that they let us access to a building and they will put their temporary stalls up. That's great in that situation. But sometimes you can't mix horses, or sometimes you can't separate horses. So just remember that livestock hold their own relationships between animals. Like these cows have to stay together because they're a group, all right? You have to remember to pick up the sick animals and isolate them, because we surely don't want our shelter to be a source of a disease outbreak. And again, when we have stallions or bulls, you understand that those need to be separated from everything else. Logistics, communication is very important. It's very hard. I will tell you that in the midst of all the towers are down, believe it or not, that messaging works better than anything, because it'll travel over the smallest wave. But you have a phone, you have access to fax, a radio. Frequently in disasters, a radio system is set up. See if the animal shelter can get a radio so they can be in all the communication that's happening. Within the shelter, do you have walkie-talkies? Honestly, it's hard within a shelter to get communication, so do you have a bulletin board where you post things that are going on? And then the media is very important. We'll talk about a JIC, or a Joint Information Center. Denise is here. She'll tell you how vital that is in a disaster to have all the information going through one place. And then you have to have traffic control, because you don't want people running into the shelter to see the animals. That's very nice, but it doesn't help the animals. It doesn't help the owners. The animals are already pretty antsy. They're away from their home. So you need people and supplies, and you need limited access. You just can't have folks running in and out of the animal shelter just for the heck of it. And you also want to keep the animals safe, and you don't want them to escape, especially if they belong to another owner. So staffing the shelter, this is actually our safety officer and a technician. We had to wash all the animals at Katrina. They all were pretty oily when they came out. So remember I talked about the incident command system. This is emergency animal shelter ICS system that was set up in District 1, which District 1, because it's on the Illinois border, is a part of a regional plan. For example, if something bad happened in Chicago, all those people would have to go someplace else. So this was set up by them. And it talks about an animal care coordinator, a medical care coordinator, which includes the veterinarians, something to register a pet and know who they belong to, and then animal decontamination. These animals don't come out clean from these disasters. Some of them have to be decontaminated because they've been exposed to a chemical or a foreign substance. So you can see all the different things. Those are the things they've identified as being important. And remember, you're not going to be the animal care coordinator for 2 weeks. You're probably going to be the animal care coordinator for a day, and then somebody else is going to take over. So these job descriptions we also have, and that means that you have to identify people who can do these things. So this is the ICS chart for the animal shelter that's way down part of operations. For an animal shelter, say you have large animals, say you've got a county fairgrounds, well then you have to have a shelter manager, and you have to have operations. You do have to have a planning, because you've got to plan every day. You've got to plan what's going to happen the next day. Like we're going to shut down the horse barn because we only got 2 horses left, or we're going to open up a horse barn because we had dogs and now we have horses. Logistics, so the operations is what doing. Planning is deciding what to do every day. Logistics is stuff, and that's stuff like cages, water, bowls, all of those things. The finance section is strictly to keep track of expenses because all of this costs. And some of it you can recover with funds. That's what the PETS Act helped us do. And some of it you cannot. So you have to keep track of how much money you're spending, and that helps your emergency manager try to reach his goal of creating. The federal government reimburses 75%, but he's got to show the 25% that he has provided. That includes in-kind things, like if somebody donates time and effort, all that can be logged in. So understand that there's a finance section. There's also going to be an intake and an exit scene. How do the dogs come in? How do they go out? Are they going out with their owner or somebody else? Very important. So establishing the shelter, and this is a shelter that we established for an exercise. We actually used stuffed dogs at that time, but we had a few live ones too, but just to show the shelter. So you have to set up, you have to intake, you have to have security. I talk about animal care. And that's actually our trailer that went up to Kokomo. We provided them with some stuff for, that's the convention center, the community center where the people were housed and the animals were housed outside under a tent. So we took our shelter up, we took our trailer up there to provide them with supplies. Task one, you've got to set it up. You've got to take one of these designated spots and say, this is where we're going to have a shelter. You're going to identify personnel assignments. You're going to make that ICS chart work and how it flows. You're going to post signage. You're going to publicize that, by the way. That's what you're going to use your Joint Information Center to tell everybody, here's where the animal shelter is. And then you're going to liaison with the citizen shelter. Are they down the street? Can they put their animals here? Can take care of them? So setup involves inventory, the mobile caches or the trailers, the signage. This is the animal shelter. You publicize that. You make sure you have to put tapes. You have to have ID badges for people. Even owners that come in need ID badges. And you have to have guidelines, and you have to have forms that go with every single dog you're bringing into that shelter. So here's the flow. Search and rescue is going to bring animals in. Owners who are evacuated are going to bring animals in. There's going to be stray animals that come in. There's going to be owners that come in and say, I can't do this. I'm moving here. I got to surrender my animal. So that's an extra animal. And then you have facilities who may need your help, may need some supplies, may need some temporary help. So what are you using? A temporary facility, an existing facility, or is it co-located with the citizens? And then the outcomes is, are you going to have the animals, the owners take their animals? Are you going to have more animals to adopt? And what do you do with those? Some of them are going to die. Some animals are going to be severely injured and have to be euthanized. And some of them are going to escape. So it's what happens at the end of this process. So here's a shelter. Here's the setup. This kind of shows, you have to know that owners come in this way and they go out this way. You have to have vet care come in a different way, and then you have to have employees come in a different way. So one of the things you are going to need from law enforcement are some security. Believe it or not, there were animals being stolen in all the disasters I was at. People were trying to take animals, but you have to have some way in and some way out. And then if animals are going to be discharged, that needs to be noted, and you need to know, and then at some point you're going to close this facility. So establish the flow. Here's where the office supplies in. We have livestock stalls. We have a kennel area. We got puppies over here. We kind of want to keep the cats separated from the dogs. They don't get along. We do surely want to keep the livestock over here. And then here's a wash area where we rinse everything off. That's one possibility. Here's Hoosier County Fairgrounds. We took the fairgrounds and we found areas for everybody. So here, for example, there's a couple ways you can do it. There's a temporary stalls that were put up in a barn for horses. Sometimes you're just stacking cages. It doesn't look real good, but it provides a place to limit the animals. And then sometimes you can use, for example, they used small sheep stalls for large dogs at Katrina because they had this barn that was meant for sheep and llamas and things like that. They were able to put one large dog or a couple large dogs in each one of those enclosures. So intake, this is very critical. For example, you see we took a picture of a dog with number 44, and that number 44 is on his form. So you identify animals either by numbers. This is where microchipping comes in. If there's one thing you can do in advance of a disaster, it's microchip animals. Having a microchip clinic for your animals or putting a microchip in your dog is very, very critical to identifying these animals and reuniting them with the owner. So one of the things, preparation tasks you can do is having a microchip clinic. And then if the animal transfers it, you gotta have a signature and you gotta have contact information. So you take a picture, it goes with this owner. You might take a picture of the owner with the dog so you knew who it goes to, if it has a microchip, and then you make sure that you have that owner's contact information. Intake, usually you want a veterinarian to look at these dogs. Sometimes you're taking in very rapidly, but even at Katrina, they would all come up and we would look at each one. We would rinse them off and do a quick examination. Is this dog okay? Does he have any immediate needs? Okay, so we would label them green, yellow, red, black. Black were the ones who were either dead or dying. You do have to do euthanasia, so you have to have access to control drugs, so you can do euthanasia and vaccinations. You know, one of the things when you do microchipping is to make sure that owners have their vaccination records associated with their microchip, and that they have it in hand. We have a great folder, a Ready Pet Go brochure that you can pass out to your owners and have them put the records in there. That way they can grab it and has all their vaccination records. You produce these for owners so that they can go places. Just make sure they have a vaccination record at home. You can put it all in a Ziploc bag. So here's my 2 dogs, here's their heartworm medicine, and here's their records. Diseased or ill, okay, so you got to separate the sick animals. Do you have special animals? We got pregnant animals in Katrina. Every disaster I've been in, there have been pregnant animals, there are puppies and kittens, and there are animals who bite. Especially in a disaster, we had to create an area for animals who bit people because it's required by law to quarantine, in every state requires a quarantine when animals bite people. When animals are stressed or in a disaster, they will bite folks. They will bite their owners. They will do a lot of different things. So you've got to have an area for these special need animals. So think about that in particular. Behavior issues. Some dogs are very aggressive. We know that. We know that there are animals that cannot live with other dogs. When we were down at Katrina in this huge thing, we had like 5 stalls that were full of animals that just didn't get along with everybody else, okay? So in that case, we have to make sure that we have an area for them. They have to be there themselves. We also had a behavior evaluator. Were they upset and aggressive because of the disaster? Some dogs are very aggressive because they always are. Some dogs are aggressive because they're in a situation they don't understand. And so we actually had somebody evaluate them outside, away from the stressful situation. When you've got a bunch of dogs barking around you, some dogs get very aggressive and they're not like that normally. Security, absolutely critical security. Animals will escape. Animals will injure themselves, and there is theft. Every disaster I've been involved in, there has been people trying to steal very nice animals for themselves. So you want to protect the animals from all those things. You want to help protect the people from injury, because animal bites were very, very common. When you have a lot of animals, and maybe you have people who want to help but have never handled animals, they do get bit. We also want to control disease spread for people and for the animals. You get a bunch of cats together, everybody knows respiratory disease can spread. So how can we take care of the animals to minimize respiratory disease outbreaks with cats? Or if you have animals and you don't know the vaccination status, we certainly don't want a parvovirus break out with our dogs. Or when we get horses or cattle together, we certainly don't want to bring viruses into that situation. Limit access. If you have a shelter where the owner can come and visit their animal, you've got to make sure that that owner and that animal have the same bracelet on so that they can visit each other. And they usually recommend that you have escorts for them. There is only one way in and only one way out, so you don't have people sneaking in and out of your kenneled area. An ID band is ideal, and they have ID bands, so put an ID band and a collar on the dog. So you got a yellow collar and a yellow ID band. These two go together, and it's got the name, and the owner's phone number is a good one because they all have cell phones. That'd be a great thing. And then you tell the owner, there's a code of conduct. You can walk them here. You can do this. There are rules. If you can't follow the rules, you can't take care of your animals. So you want to help care for the pets, but don't allow handling of other animals. If the owner comes in and says, well, I can take care of that dog. No, we want you to take care of your dog. And we also usually require that there be an adult take care of it. Children sometimes, unfortunately, get bit unless it's an older child. I had One of my fellow team members was at a shelter where they had a 14-year-old, but she was most familiar with dogs. They did allow her to handle the animals, but they tried to stick to the adults handling the animals. Animal care, every day you gotta look at these animals. Are they eating? Are they drinking? Is a cat using their litter box? I was amazed at Katrina. There were 500 cats down there. I thought, oh my gosh, 500 cats. How upset were they? Once they got food, water, and a litter box, those cats were really happy. It's the dogs who were barking like crazy. So every day we have a sheet that you can access. It says, are they eating? Are they drinking? Is there vomiting? Is there diarrhea? Are they coughing or sneezing? Because you have to get the sick animals away from the healthy ones so you don't have a disease outbreak. They need food and water. Especially if people are evacuating and their dog needs some special food, they need to bring that with them, because the kind of food and water you're going to have is just basic. Sanitation, we've got to have a way to clean the cages every day, and you got to have a place to put that, because that creates a lot of garbage. So that's your county emergency manager. I am going to fill up dumpsters. Who's going to come empty them? Exercise, pets require exercise. We don't want them to escape. If you have a fenced-in area, that would be great, but if you're walking, you gotta have rules for people walking, and a daily census every day. I've got 25 dogs here. Today I got 25 dogs. The next day I have 22. What happened to the other 2? Make sure you can document where the animals are and where they went when they leave. Food and water, dishes have to be washed. Use a lot of disposable. We use a lot of paper plates. They're not ideal for food, but they work. And then water, sometimes you have disposable bowls. Potable water, remember, animals have to drink clean water too, and then appropriate feed. You prefer new bags. For example, in a disaster, Hill sent us down, for example, we had a lot of dogs with diarrhea, stress related. They sent us down a whole truck full of ID. It was ideal for these dogs with really loose stool. And so remember, you want higher quality food. These animals are stressed. And remember, you will get food. Every disaster I've been in, they've gotten way too much food. They're in medical care. You need somebody there on site every day, at least to check on. You need somebody to keep track of the issues. Maybe the veterinarian's going to stop by in the afternoon. Okay, here's the dogs that need looked at. Some of them need a lot of care, and that's where you need an owner to say, this one needs a lot of care. This one's going to have to go to a specialty clinic, have its broken leg fixed, have this eye attended to. So the good idea is if you have a veterinarian come in every day, say, I'm coming in at 1 o'clock, tell me which ones are sick. Minor first aid stuff we can take care of. If it needs something that needs a lot of care, you have to talk about transfer to a clinic elsewhere. Safety. That's actually occurred to Katrina. Those horses, I'm not sure that horse has survived because that water's pretty nasty and probably did a job on his legs. So you need people who can handle animals. People come down and they say, I want to help. I can handle animals, but you really want people who have that skill set. People who work in shelters, are animal control people, or humane society, you would like them to do the animal handling. You do not want people to handle livestock like horses and mules and donkeys unless they do that all the time, because that's a different set of skills. And then if there's alternative livestock like elk or deer or bison, that's going to require different things. And then you begin to small pets like guinea pigs and hamsters and some reptiles. Remember that reptiles require some sanitary work, so you want to make sure that you handle them appropriately. Restraint, we use loop leashes for dogs. Those mesh leashes work really good. A lot of clinics have a lot of those. A lot of shelters do too. And make sure that your dangerous dogs are separate. Our dangerous dogs were separate. They were only handled by the animal control people who had the rabies poles to do them with, and have perimeter fencing, but make sure they're separated. Make sure only shelter professionals handle those dangerous dogs. There may be a point in which you have to euthanize them for the safety. You don't want to do that, but remember that it's important to understand that this is a disaster. We can't save every single animal. Bites and scratches. All bites are reportable. All 50 states require that if a dog or cat bites a person, that it's reported. So make sure that no matter if it's a disaster, the health department's going to want it, is going to want it reported. So make sure that when that happens, the person is identified, the dog is identified, they're quarantined, and just be aware that accidents do happen. Nobody wants them to, but they do, and make sure you follow what the local health department wants you to do. Rabies prophylaxis, we always recommend veterinarians and their staff, and especially shelters that handle animals, have rabies prophylaxis. It's a series of shots. It's pre-exposure prophylaxis so that you have less shots afterwards. Remember that just because the animal bites doesn't mean it has to be euthanized, but it does have to be quarantined for 10 days. Make sure, again, if you have a bite with an unknown animal, that it's quarantined. If it's not there, work with the public health department. We have to follow the laws in place for bite exposure. General safety considerations, think about this. If you don't think you should do it, don't do it. If you have a volunteer that says, well, I'd like to take this dog out, but I'm not sure what it'll do, then don't do it. Find somebody who will. If you're asked to do something that you're not qualified for, like I've never handled a horse before, or you have a volunteer that says, I've never dealt with cats very much, don't make them do it. Try to fit the job to the volunteer. Find the right person and the right equipment, especially if it's a dangerous animal or it's a livestock. Do you have a bridle? Do you have a lead rope? Do you have something that you need for a bull or stallion? And seek appropriate supervision. And there's always a safety officer. If you looked at the ICS calendar, you saw a safety officer. And the safety officer is a person that's in charge of safety for the whole incident. So you should have a safety officer at the kennel that says, okay, we're not going to let you handle that dog, that horse, whatever. We'll wait till so-and-so comes in because that could be a dangerous situation. The safety officer can shut anything down at any time because it's not safe for the people involved. Biosecurity, it's a decontamination. You want to isolate high-risk animals. You want to have a written cleaning and disinfection protocol. You want to know how the cages are being cleaned. You want to limit access. We don't want people walking through the animal shelter. We want everything cleaned and disinfected. We don't want to be involved in a disease outbreak, either for the animals or for the people. This is not a petting zoo. This is not a socialization place. It's really just a temporary shelter. Biosecurity, wash your hands frequently. Don't eat or drink in the animal areas. Use appropriate PPE. If you have a dog that's sick or you have something with a discharge, like on their coat, use gloves. Wash everything, use gloves. Those can be changed. And disclose animal contacts to a physician if you become ill. But use the appropriate PPE. We have lots of it. And with COVID, we've all become used to PPE. There may be a point at which you need to use masks, in certain areas because you have a lot of sneezing cats you don't want to spread around. All right. So gloves are going to get used a lot. So make sure you have access to disposable gloves. Exit strategy. If you open a shelter, you've got to close it, especially if it's a temporary one. Even if it's in your permanent shelter, you got to get back to the business of rescuing your strays and adopting animals. So what's your exit strategy? When you start, think of your exit strategy. When I was down at Lamar-Dixon, that was the 1st of September. Their goal was to close it by October 15th. That was 6 weeks. That's a long time to maintain that shelter, but that was their goal. So how many is enough? When you get down to 5 dogs, can we close this temporary shelter down? How much are they willing to pay? Because every day is a cost to somebody, the local government, the shelter, whoever. When does the owner become financially responsible? When that owner drops that dog off, you have to tell them, we're going to be open for 2 weeks. You've got to find something to do with your dog if you don't have any place. So tell the owner he's responsible for his dog. And what constitutes a legal release? Well, the remaining animals go back. So you get stray animals or you get owner surrender animals. So what's going to happen? Are they going to end up in the shelter? Are they going to go to other shelters? Do I have fosters? Do I have rescues who will take them? All of those decisions have to be made in closing a shelter. So transfer to known owner. You tell the owner, we're going to be open for 10 days, for 2 weeks. You have got to find it. You either got to find a boarding kennel, you got to find a pet-friendly hotel. That's something you need a list of because pet-friendly hotels will sometimes take people in a disaster. And even hotels who generally don't take animals may take them for a short period of time. And is the owner agent, are you going to transfer it to a foster? I can't take care of this dog anymore. Maybe an older person is going to move to a different state. Please take my dog. Okay, you have to have a foster. So you're either going to, if you have an unknown owner, they don't have chips. That's a great thing about microchips. You can at least connect them with where they came from so that you need to go to the shelter or do they need to go to a boarding facility because the owner has to rebuild their house. That's their responsibility. Return to the owner agent. That's absolutely ideal. This is Dr. Strasser at an exercise we did up at Valparaiso University, which is one of the sheltering spots for Chicago. She took the animals in and we knew where the owner was going. or is it going back? So is it going to return to the owner? That's ideal. The owner drops it off, the owner picks it up. Transfer it. Is it been surrendered by owner? Is it going to go back to the shelter? Is it going to go to foster care? Does it need additional veterinary care so it's at a veterinary hospital? Mortality. You know, we tell you to take pictures of dead animals. That sounds awful. But the owner, we took pictures of dead animals at Katrina. The people could at least say, there's my dog. It passed away. Give them closure. Are there diseased or injured animals? Some of those are going to get euthanized because the owner either doesn't want to deal with it or there's no other place for them to go. Some animals escape. I know they escape. Maybe you'll pick them up later. Maybe somebody else will pick them up. And then adoption. You have these extra animals. Katrina animals became very popular to adopt all over the country. I think there were a lot that were adopted that weren't necessarily Katrina animals, but that's okay. You probably saw in Joplin, they had an adoption event. They had so many extra animals. After the Joplin tornado, about 2 months later, they had an adoption event. People came in from all over to adopt the animals. So sometimes there's an adoption event to adopt animals that were found in a disaster. Holding period is, we don't have a state law on holding periods. Local people do, okay? In Indianapolis, I think it's 5 days. Someplace it's 3 days. So you have to hold that. So you have to coordinate with that with the local jurisdiction, find out if they have a holding period, because there is no state holding period. It is a local decision on how long to hold animals. Documentation, owners have to have ID. That's why a microchip is good. That's why they're having all the identification. Maybe their vaccination certificate from their veterinary clinic. That's another way you can connect them, is go through their veterinarian. Do they have a receipt from the intake? Do they have a microchip number? Do they have an ID with an address matching the search and rescue form? Involve animal control and shelter personnel. Again, microchipping is really nice when you can connect it with the owner, connect it with the veterinary clinic and the veterinary records. Maintain records for each animal so that when they leave, you can say, here, the animal was here for 5 days. We fed it. It had no issues. Here's the paperwork to go with it. Goal is reuniting with the animal or transferring to a facility. Depends on accurate records and security. Once again, people will try to get into this animal shelter, and maybe it's just to pet the animals, but we are not a petting zoo during a disaster. So emergency animal shelters protect both animals and people, involve many different animal populations. That's for you to determine and run through the instant command system. It's really important to understand instant command. It can be managed through an ICS type structure. That's the best way to do it because your county emergency manager does all of his things through the instant command structure. Okay, I think that's it. Yep, that's it.
Great. Thank you so much, Dr. Norman, for a fantastic presentation. With that, I wanted to thank you all for joining, and we have reached almost the end of our time, but we have a little bit of time for questions. So if anyone has any questions, please put it in the chat or we can unmute you. So please raise your hand if you'd like to be unmuted, and otherwise, please put your questions in the chat box at this time. And I'm not sure, Denise, or Dr. Norman, if you had seen any on your end.
No, she's not seeing. The one thing I want to emphasize to you is the American Veterinary Medical Association now has a disaster certificate program. I think it's free to members, might be free to not, I'm not sure, but the AVMA has a disaster certificate, has a number of courses you can take that talk about disaster planning. So I would encourage you to take that. AVMA members, I think it's no cost. I think it might be minimal cost to non-members, but it just shows that you've gone and understood the instant command system and disaster response for animals.
Great, thanks for mentioning that, Dr. Norman.
I know this is a lot of information, but I really depend on the veterinary community to be a leader at the local level to help them understand the issues that go with animals. And it's where everybody can come to the table. You frequently talk to the animal shelter, the law enforcement, the health department, bring them to the table and do a little planning in advance. No questions? Okay.
No
It's a
questions?
lot of material to absorb.
All right. Yeah, that's a lot of material. You've answered all the
Yeah.
questions, Dr. Norman.
I wish I
So
did.
thank you all very much for your time. We really appreciate it. And it looks like we're at the top of the hour. So again, thank you for your attendance and thank you, Dr. Norman, for your fantastic presentation. I hope you all have a wonderful
Happy
day.
to do it.
Thank you.